Hey everyone, it's Dr. David here, streaming live. We're going to cover the best treatments to avoid knee surgery and heal from an ACL tear. I'm looking down at my camera here because I want to make sure I get all the systems set up. It looks like we're going live on all platforms now. We're live on YouTube, on Facebook, and on Instagram. I can see comments coming in from anybody that's going to comment from Facebook and from YouTube. Instagram, I can't see your comments, guys. If you have an ACL problem or you've had one in the past, like years ago, a decade ago, or if you had a surgery on an ACL, this is going to be helpful information for you. And if you have questions about, like, you also have a meniscus tear in addition to your ACL tear, or you have osteoarthritis now, and you started with an ACL problem years ago, maybe decades ago, this is going to be helpful information for you as well. And ask a question so that we can get you the help that you need to tweak the information that I'm telling you here for your specific condition. And then I expect people that just have an ACL tear, those of you athletes, those of you youngsters on here. Can you guys hear me? I see 37 people on right now. We got a thumbs up on Facebook. Thank you. Cynthia Joseph is on here. She says, "Good evening, sir, from Trinidad." Oh, Trinidad and Tobago in the house. Fantastic. So jealous of your island life. I'm here in the desert, all sand but no water, but it's pretty cool. I like El Paso. We're fantastic here too. Kimberly's here. Hey, Kimberly. She says she can hear me. Fantastic. Thank you guys for letting me know you can hear me. I am SV Logs says thumbs up. Mary Ann, I can't say the last name, says I can hear. Lori says, "Hi, Dr. David." Fantastic. Hi, Lori. All right, guys, I'm going to get going into my info, my presentation for you guys here today. So ACL tears, let's just talk through what this is. Do I have my knee model? Oh, no, I don't have my knee model. That's the one thing I forgot to bring in today. We will use the skeleton then. With the ACL tears, so you probably hear about ACL tears all the time, especially when it comes to athletes, like people that are in sports. You commonly hear about it in soccer players, basketball players, football players, and volleyball, any sort of jumping sport, any sport that requires different changes in direction. So, like, you don't typically hear about ACL tears in like runners, in like cross country runners or track runners. I mean, it happens every now and then, but you hear it way more in sports that require different movements, or even just people that are exercising on a consistent basis. Sometimes they'll develop an ACL tear as well. But what the ACL is, it's not pictured here, but it's a ligament which connects bone to bone in the knee. This is the knee. Here's the thigh bone. There's the kneecap. Here's the shin bone. And deep inside the knee, in here, kind of where this metal piece is, that's not the ACL, but that's where it could be, where it is more or less. It's a ligament that connects from here to the inside of the knee, and it connects the two bones together. It's very important for stability, and it helps to prevent too much motion in this direction. So you can see that's the left foot right there, and so going this way, sorry, this motion right here. So if your knee caves in, that tensions the ACL, and its job is to protect your knee from caving in too much, so that you don't hurt your knee. If you don't have good support though in the muscles, then you're at risk for tearing your ACL, whether it's a possible tear, a full tear. There's also an avulsion where you don't tear the ligament, but the bone where it attaches breaks off. And very often ACL tears end up with surgery. You hear about that in the sports world all the time too. There's really good surgeries out there, ACL repair surgeries, and there's a variety of them now. There's some where they'll take a section of ligaments from other parts of your knee or tendons from your hamstring, and they'll use that as a new ACL, and they'll install it. They'll surgically install it into your knee, and they tend to hold up pretty well as long as you don't re-aggravate it, as long as you don't have some incident where it becomes injured again. Now you often hear about these getting hurt in like sporting injuries, like somebody fell into the outside of the leg. So this is the left leg. Somebody falls here and it forces your knee inwards. Like if you're in the American football world, you hear about the quarterback holding the ball, looking this way, and then getting hit from the opposite side. it's always a terrible situation. And I hope and pray that they're not hurt. It's always a relief whenever I see the quarterbacks get hit like that and they get up and they're fine. I'm like, oh, thank goodness. It's always an absolute tragedy whenever you see them don't get up and they stop the game and have to bring them out. And I'm always like, oh man, that looked bad. I hope he recovers really fast. But it happens in other sports too. You see people just jumping, like in volleyball and basketball. It happens quite a bit too. So how do we heal the ACL naturally? Let's answer that question with these 10 points, because it's possible in a lot of cases. Like I would say most of the cases of ACL tears, even when it's kind of a bad tear, it's possible to heal it naturally. So let's go through it. Number one, let me get to my notes here. You have to, like I have consistently found that you have to wear a brace. And think about it. If your knee tore a ligament and now you lost the ability to control this inward motion, you need to have a brace on like this. Now this is I like this brace. I don't have an allegiance to any specific brand of brace. What I find is that usually the more you spend on a brace, the better it is. This is like a mid-range brace. What this brace has that somebody with an ACL tear would need is hinges. It's got these hinges right here, one on each side of the knee. It's got these nice straps. So it's a pretty solid brace that prevents side-to-side motion, which if you tear your ACL, your knee's going to want to cave inwards. And you want to prevent that. Having this brace on appropriately and making sure that it's sized for you, because these come in different sizes. The size right here, see that one's I don't know if you can see it, but it's a large. They come in small, medium, large, extra large, extra large. You can get these off of Amazon. The box looks like this. It's a Shock Doctor brace. And generally, you pay more for better materials. They all kind of work the same as far as like their function on your knee. But this one will run you anywhere between $50 to $100, depending on where you are in the world and what size you get to, because the bigger ones have more material. I think they charge more for that. But totally worth it. I'd rather pay $100. You might get two because these start to smell, after you have it on all day, especially if you live in warmer environments or it's a warmer time of the year. And so you might want to put one in the wash. You have to wash these by hand usually. They used to make them so you could take the hinges out and throw it in the washing machine, but the new ones don't have that. Or maybe I haven't figured it out. Either way, keep them clean so you don't develop a rash or anything like that. But having the brace on makes the world of a difference. Now, if you tore your ACL, you're looking to avoid surgery, and you go get a brace like this, and you feel better right away, chances are this is going to be really good for you. And as long as you follow the plan that heals your ligament, your ACL, anterior cruciate ligament, then you're going to not need surgery. But a brace is a huge component of this. The mistake people make is they don't wear a brace at all, or they get the wrong brace. I just showed you the brace with hinges. This is just I would call this a knee sleeve. It's not really a brace. And you can see this doesn't have any brackets in it, any hinges or straps. It's a sleeve. You just put it over your knee. This is more for just general pain relief. Provides little to no stability. You need the brace with the hinges and the straps if you're trying to recover from an ACL tear. You just absolutely need it. Now, whether you just tore your ACL like recently, like days ago, or you've been dealing with pain in your knee that started when you had an ACL injury years ago, even decades ago. Because what I see that often happens is people injure their ACL. They never really get treatment. They don't have the surgery. They don't get back to sports as normal. And they just kind of pain manage their way through life. And they like give up sports. They give up doing high level activities. And they just don't do anything that bothers their knee. But their knee's not 100%. They never went through the time period of wearing their brace. And if they just went through the brace for 2, 3, 4 months, really as long as it takes. If it takes 6, 10 months or a year, I would put it on. If you feel consistently better when you have the brace on, wear it until you don't need it anymore. I personally went through, I didn't have an ACL tear, but I had another ligament in my knee, which it was similar to an ACL tear. I went through an injury like this, and they told me, put on the knee brace for 2 months, and if it doesn't heal, go get surgery. After 2 months, I felt better, but not 100%. But I was not going to go have surgery. It took me 10 months of wearing the darn brace. I hated it. It always slid down. I had to pull it up. I had to get multiples of the brace. I had to modify my exercise, but I could exercise and my knee didn't feel any worse. And after 10 months, I felt confident in my knee. And this was years ago. This was probably like 8 or 9 years ago. I run, I lift weights. I don't have any trouble in my knee. And it was just a darn little brace that fixed the whole problem. So very doable solution. You just have to make sure to stick to it, because this is probably going to be the crux of your treatment, like the main thing of your treatment, especially upfront, like in the first half of your recovery after an ACL tear. And like I was saying, if you've had a tear for years, you could probably start wearing the brace today. And if you feel an instantaneous improvement, as long as it's the right fit and the right kind of brace, you're likely going to improve the stability of your ACL. It can still stabilize. There's still other stuff to do. I'll talk about it here in a minute, but you should probably get a brace anyway. I got this one off Amazon. It's a Shock Doctor brace. Moderators, if you're watching right now, if you can find the link for this on Amazon, Shock Doctor knee brace with hinges on the side. Like I said, you don't have to get this one. If you want to get a different brand, as long as it's got those hinges, it makes a huge difference. Box looks like this. They've made them for a long time, and I've had a lot of success with this myself and with other patients. All right, can't hammer that home enough. I will probably bring it up again because it is a thing that nobody wants to do, that they should all be doing. But for some reason, people don't like to use a brace. You just have to use a brace. You just have to. Think about it this way. I'm not going to get off the point because it's so important. Would you rather go have an ACL surgery, because that's what we're trying to avoid here, and then you have to be in the brace anyway, and the brace is going to be way bigger, and you're dealing with a recovery from a surgery? Would you rather just put on the brace for probably a shorter amount of time and not have the surgery, or be forced to wear the brace, go through the surgery? Oh, it's a no-brainer to me, but your situation is unique. You got to figure out what works for you. All right, next point. You have to offload. Let me break this down for you a little bit. You have to get off your leg, especially if it's a fresh injury or it's very aggravated, because it could be that it's not fresh, like it happened in the past, like months or even years ago. But if you stand on your knee, especially if you try to balance on one leg and your knee hurts or it doesn't feel stable, doesn't feel good to use it, then you have a stability problem and you need to offload it until you can stand on one leg and walk and do normal activities. I'm not asking you to go hopping on one leg or play sports, just basic things that you need to do for life. If you have pain standing on your knee that you hurt, then you should be offloading until this gets better. So put the brace on, not going to let that go, and then get in crutches. A walker or cane could work too, but crutches is probably going to be the easiest thing to use. Crutches are not that expensive, $30 to $40. They have them all over the place. You can get them at your drugstore, most grocery stores that have a first aid department, department stores like your Walmart will have them. You can order them on Amazon. So many different options to get crutches. Shoot, if you want to get the real cheap option, go to your thrift store in your area, and I bet they'll have some crutches that you can get for pretty cheap. Because people buy crutches and then they need them for a short time, then they don't use them for a long time and they end up getting rid of them. And your local thrift store probably has a section of crutches and walkers and wheelchairs and stuff like that you can get for cheap. Whatever you want to do. Anyways, if you offload, think of it this way. If you were to roll your ankle and tear a ligament in your ankle, the whole medical world is like, get on crutches, put a brace on, and stay on crutches until it gets better. So that makes sense to most people. But for some reason, when you have an ACL tear, people don't get told that. They're just like, oh, well, let's do an MRI and then probably do surgery. And they skip all the basic things that work for the body, like put on a brace and then get off of it. Because every time you stand on it, your ligament's like, I can't do that. And your knee just doesn't work right. And you're just straining the ligament even more. It's trying to heal and your ligament's like, I'm not ready for that. And you stand on it and it just gets stretched out more. And you keep aggravating it like that. And if you try to walk on it and force your way through life and it's hurting you, you need to be on crutches. Just get off of the knee and you're going to expedite the recovery. Your ligament will start to heal. There's cases. It's a regular thing that we've documented in research where it's a full ACL tear and then it spontaneously heals. And I think what it is maybe it's an MRI false positive, meaning your MRI showed that you had a full ACL tear, but it wasn't actually torn. Because I had a patient, I'll give you a story. Had a patient that I saw, not the fittest person, fell down some stairs. That's how she tore her ACL. She came in trying to avoid surgery. I said, absolutely, I can help you. I did the ACL test. There's a Lockman's test. There's a bunch of tests. And when I tested her ACL, I was like, it feels completely torn. And she hadn't gotten the MRI yet. She was adamant on like, I don't care if it's completely torn. Like, I'm gonna do whatever I can, because I've heard of stories of athletes that have complete torn ACLs, never had surgery, and they're, winning Super Bowls and doing all kinds of crazy competition stuff. So she knew it was possible. Anyways, she gets the MRI report, a few treatments in. She's doing better. I followed the protocol, which is brace and offload. That was the first thing we did. I did some other stuff, which I'll get into. She was gradually making improvements. Come to the end of her treatment, we're about 3 to 4 months in. She's lost the brace already. She's minimally using the crutch. She's walking quite a bit more. She's getting back to normal. Her ACL is doing fantastic. Then she goes on a trip, visits a friend who also tore her ACL close to the same time that she had her ACL tear, but she had surgery. Her friend had surgery. And her friend revealed to her, she says, the doctor told me after my surgery on the surgical report that when they cut me open to fix my ACL was actually intact. Now it could have been partially torn. There could have still been damage, but then what she said is, then the surgeon they ended up cutting my ACL and doing the repair anyway. And this sounds like crazy at first. You're like, oh no, the surgeon found your intact ACL and then tore it anyways, and they're trying to steal money. And there's a reason behind this. What the surgeon's thinking is, I have to leave this patient better than I found them. So if I'm going in and I find an intact ACL, we know, because this is true, they find that if they repair the ACL with their surgical procedures, it usually ends up stronger than the original ACL. So that was the surgeon's intent. They're trying to do good by the patient. So it makes sense from the medical perspective. However, from me being a medical professional myself and from the patient's perspective, it's like, why do we even go in there in the first place? We shouldn't have never done this surgery. But from the surgeon's perspective, they're doing the best they can with what they know. They know how to do surgery, not avoid knee surgery. So it depends on who you're talking to. If you're talking a lot to a surgeon, you're probably going to end up with a surgery if you have a surgical condition. But if you want to avoid surgery, get on those basics. That's why they don't recommend these basics, because they're trying to figure out how to help you with surgery, because that's what they're trained to do. So anyways, if you had surgery, by the way, and that was your case, and you're like a little angry right now, like, the past is in the past. You can't undo it. There's things that you can do to protect your knee from problems in the future, from another ACL tear, from meniscus problems, osteoarthritis issues, and definitely a knee replacement in your later years in life. So stick with me here, and it's okay. Don't get too angry. Just let's move forward. All right. So sorry, that was a tangent. That was a side note on offloading. Start offloading. It's the basics. As if you had an ankle sprain, you would brace it and you would offload it by using crutches. Same exact treatment for an ACL tear. Offload and get in a brace until it starts to feel better. You can start to tolerate a few more things. All right, so once you can tolerate a few more things, what do? You need to start working on glute strength. Glute strength is critical for the knee. And here's why. So here's your leg. Foot's down here. Let me get back so you can see the entire leg. And you can see the skeleton here, so it would attach right here. There's the socket. So the butt, the glute, is right back here behind the thigh, at the top of the thigh bone. This is the femur. Because the glute doesn't attach directly to the back, it attaches to the side of the thigh bone. When it shortens, yes, it does extension. It moves your leg backwards on your body this way, but it also has the ability to rotate outwards for your thigh. So it can make your thigh rotate this way. This is huge, okay? Because The ACL gets torn when your knee goes this way. That means your thigh bone is relatively turning inwards, rotating inwards when your knee goes this way. But if you have good glute strength, then you're going to protect your ACL by not easily allowing it to go in this way. But if you have weak glutes, glutes aren't going to do a good job of protecting it this way, and they're just relying on the ACL to not tear when your knee goes this way. So getting better glute strength brings your knee into a better position, which takes tension off your ACL. Now, in the extreme example, like you get hit, sporting accident, you're going to be better protected. You're going to be able to better take those hits and not get hurt. But in an everyday non-extreme example, because there are people out there that end up with ACL injuries that creep up. We call them non-traumatic ACL injuries. They didn't have nobody fell into them. They weren't in an accident. They just started to develop an ACL problem over time. And the reason for that is because they got weak glutes and weak other muscles, I'll tell you in a second. And every time they walk and step, excuse me, their knees just cave in a little bit. They step and then their knee caves in, and they just tension their poor ACL every step they take. And just think about it. If I took your finger and just did this repeatedly, taking it to its extreme, right here where you feel the stretch, something's going to break there eventually. It's just a matter of time. Get a swig here. So it makes sense to have strong glutes so that you're protecting your ACL from being on a small level, constantly overstretched every time you take steps. You need to have those knees not cave in. They need to be aligned straight up and down and bend in that plane of motion, in that direction of motion over your foot. So getting strong glutes helps tremendously. You have to up your glute strength. That's a common weakness I find in people that have had an ACL tear as well. So they need more glute strength. All right, what's up next here? Oh, thanks, appreciate it. Bring me some water here, my team. All right, next up we have ab strength. This one gets overlooked so much. Sorry, that's not an E, it's an S. Abdominal muscles are so critical to the stability of your pelvis and your glutes. And that stability is necessary for you to have stability further away from your body. So down your arms and down your legs. And so many people skip ab day. Admittedly, I'll ask patients to come in with an ACL tear. When was the last time you worked out your abs? And they're like, can't remember. Don't know if I have. And sometimes they have, but then if they have, I'll ask this question, because this may be you. You might be an athlete and you're like, I work my abs out all the time. As a matter of fact, when was the last time that you felt your lower abdominals get tired or get sore? And what I mean by that, if you look at the skeleton here, the abs attach to the rib cage and all the edges of the pelvis. So these are your pelvis bones right here. So all this and all this is abs in the front. The midway point is the belly button. So if you divide your abs at the belly button into an upper half, your upper abs, and a lower half, your lower abs, most people, when they do use their abs, they're overusing the upper abs and they miss using the lower abs. It's rare that I find somebody with good lower abdominal strength. Very rare. Because the people that I'm seeing are usually injured somehow. They're looking to avoid surgery. And one of the big things that leads into these injuries is weak lower abs. And those lower abs are specifically concerning for me because they attach to the rim of the pelvis here. They give this pelvis lots of support. And if you don't have good support from your pelvis, on the backside of those bones is where your glutes are, which keeps your thigh bone in the right alignment, which protects your ACL. So abs are foundational to your glutes working correctly, which helps protect your ACL. You need to have good ab strength. So whether you're trying to avoid a surgery or you already had a surgery and you're still having some pain, go think about working those abs out, especially focus on those lower abs. They're going to be most important for you to get stronger in your abs. All right, next up we have feet. Overlooked all the time. Whenever I see people going through ACL rehab, whether it's for they had surgery or they're avoiding a surgery, like the foot's never taken into consideration, and it's kind of frustrating for me. I'm being very polite when I say that. It's extremely frustrating for me. But the reason why it's so important is because if you look at the foot, there's the arch, right? You have an arch in your foot. You should, as long as you can develop an arch, because some people are flat-footed, but they have what's called a functional flat foot. What that means is once they bear weight, then it flattens out. But if they take weight off the foot, then you can see an arch. That means you can develop an arch. So what should happen when you bear weight on it is you should still have an arch. There's muscles that support that arch. And many of those muscles, a lot of them, help curl your toes. They curl your toes down. Those tendons run through right here. And when you have good toe muscles, good toe flexor muscles, then your arch is well supported when you bear weight on it. And if you don't have good arch support from those toe muscles, when that arch collapses down, it moves the ankle inwards and it moves the shin bone inwards, which then moves the knee inwards, which tensions your ACL. You need good arch support from your toe flexors in order to minimize or really take completely off the pressure from your ACL. So it's a combination of foot strength so that you get support from the bottom up, glute strength so you get support from the top down, and abdominal strength so that that support can be well supported up top. So you can have good glute strength from the pelvis being supported. If the pelvis isn't supported, your glutes aren't going to work as best as it could. You got to have good glute strength and good foot strength, glute strength, and abdominal strength. All right, let's go to the next one here. We've got insoles. This can make a big difference if you're recovering right away. If like you just had a tear, or if it's aggravated, but it's been a while. And the reason is, here's my insole. So this is an insole. They call them orthotics as well. Shoe inserts is another name. All the same thing. These are over the counter. We'll see if we can link these in the description. There's different varieties, and I'm not, just like the knee braces, I'm not committed to one. I think you need to find the one that best fits for you. Though, if I had to pick one that I like, Superfeet is the brand that I like. They have a variety of different ones that's shaped for different foot situations. But what I tend to find is the blue one, because they go by colors. The blue one tends to be the one that people need the most. That's what I end up recommending the most. And they're a little higher end, but they last longer than these cheaper ones. And I always recommend you get 2-3 pairs depending on the shoes that you wear. That way you can have them in multiple shoes. But here's the thing. If you have that arch support right here, then it assists your weak toes, because it takes you a while to develop the strength in your toes to support your arch, but you can shortcut it by getting the right insole, the right shoe as well, because sometimes shoes will have support. And that'll make your knee feel good right away. So if you just got hurt, so far, just to recap, you need to be in a brace. You need to offload. If you just got hurt, I would wait on the glutes, abs, and feet, because that's going to be when you're not as hurt. And then get the insole. And you need to be minimizing how much weight you're putting through your leg, stabilizing with the brace. And then when you do end up putting some pressure through your leg, have support for the arch of the foot by having the insole on. All this is going to maximize the ability for you to heal, because you're taking all the tension off of the ACL, because you just don't want to be aggravating it right now. Give it time and space to heal, and it will heal. All right, next up, we have, you need to avoid, I'm just going to write that, quad strengthening. You need to avoid it. This is controversial. I always get a lot of beef about this. And the reason is, I'll make it as clear as day. Let's go back to the muscles discussion here. Remember we talked about the glutes connection, and they make the thigh bone want to turn out and get in the right alignment, and it takes tension off the ACL. Well, there's quad muscles in the front of the thigh. They connect to the kneecap right here, and they connect to different parts of the thigh bone. They call it the quad muscle because it's a group of 4 muscles. One of them, though, it's called the rectus femoris. I'll show you where it attaches. If that's the position of the thigh bone, that rectus femoris attaches right here on the front of the hip bone, of this pelvis bone. So it actually crosses the hip joint. As a result of that, the angle of pull that that rectus femoris puts on the thigh bone is it makes it want to turn inward. So if you're quad dominant, you're going to be turning inwards. Chances are, if your tendency is to go inwards already, you've already developed a quad dominance. So it doesn't make sense to further strengthen your quads. And even if you don't have a quad dominance, because maybe you had an accident, somebody fell into your leg, that's how you tore your ACL, well, don't start training into a quad dominance after that, because you're going to just want to turn your thigh bone inwards. Strengthen the glutes instead, because it turns your thigh bone outwards, which takes tension off your ACL. It's not add any tension to your ACL. Now, the only time that I do tell people, yeah, you should work out your quads, is right after ACL surgery. Consistently. Happens quite a bit. After ACL surgery, quad muscles shut down because they had to go into your knee. And whenever the knee is operated on, it's very common for the muscles to all shut down. Sometimes they put nerve blocks in your muscles so that those muscles just don't start going off on their own. And you have to wake the muscles up after surgery. So doing quad activation exercises might be necessary. But once those quads can activate and you have conscious control over them, you're done. You're done. Work on the glutes, work on the foot muscles and the abs, because chances are that's what's weakest and that's what needs to get stronger moving forward. And you don't need to focus on the quads anymore. Now, I'm not saying never, ever exercise your quads, because the quads will indirectly get worked out. As you get back to walking and get back to sport level activity, you have to use your quads. They're definitely going to be used. But if you make it glute dominant, you're using your feet right, and you have good ab strength, then you're putting the right balance through the entire muscle system for your leg, and you're not becoming quad dominant, which forces more tension through your ACL. So don't focus on the quads. All right, we have 54 people on live with us. We're live on YouTube, Facebook, and Instagram. Thanks for joining us, everybody. I'll get to some questions in a minute. Working my way through my list here. I got a couple more things to share, a few more things to share with you. Next up, we have avoid hamstring strengthening. Similar to quad strengthening. If you focus on hamstring strengthening, that also crosses the hip joint, and the way that the hamstrings act on the knee, it tends to force them inwards. It's just not a good idea. Hamstring's job is to decelerate extension. You might not get that. That's kind of like higher level thinking, but let me, you're smart. Let me explain this a little more plainly. Hamstrings attach to the sides of the shin bone right here. This is the top of the shin bone. And then they come up and attach into the seat bone, right back in here where you would sit. All that space is covered by hamstring. Hamstrings, we think of them in the medical field as knee benders. But the way I think of them, because that's the way they work, is that how often are you forcefully bending your knee? Not that often. But when you walk, when you go to take a step and you're swinging your leg through, your hamstrings are working to slow down, to decelerate how fast you extend your leg to land on it and then progress walking. So focusing on hamstring strength, if you already have good strength too, not really a good idea. What I would tell people all the time that want to work out their hamstrings is I say, because it's not terrible. It's not as directly aggravating to the ACL as quad strengthening is, and adductor strengthening. I need to talk about that. But if you had to choose between hamstrings and glutes, work your glutes all day. If I have somebody working out their hamstrings, what I'll do right away is muscle test their hamstrings and then muscle test their glutes. And consistently, I find weakness in glutes and a lot of strength in hamstrings. So why work hamstrings out more if your glutes need a lot more attention? Focus on the glutes. The payoff's going to be much larger for you. Plus, you're going to have direct offloading of the ACL if you get your glutes stronger. It's working glutes. All right, next one. Learn walking and running again. Sorry, I know it's not correctly. Learn to walk and run again. What I mean by this is the coordination needs to improve, especially if you had that gradual ACL aggravation that's happened over time. Like you didn't have an injury, you didn't have somebody fall into you, but your ACL's kind of gotten worse and worse over time. That's what happened to me. It wasn't my ACL, it was the posterior lateral corner of my knee that I got hurt. But anyways, you need to learn how to use your glutes in the right timing, how to use your abs in the right timing during the walking cycle, and then use your toes properly too. And if you don't learn how to do that, then you're by default, your body's just going to figure out a way to do it. And it very often ends up becoming quad muscle dominant. And you won't use your feet because you're in shoes most of the time. You don't have to worry about what your toes are doing. But if you're conscious about it, then you have a chance to get your arches stronger and make your glutes work to align your thigh bones properly and take tension off your ACL. So you have to slow down and figure out walking. I talk about it all the time on their channel here. And by the way, I haven't even mentioned, I've got a program called the ACL Tear Recovery Program. It's my whole treatment approach where I organize all this information and I unpack it very much. And I go through walking and eventually running. I cover running on there too, so that you're not aggravating an ACL tear. So you can heal naturally and avoid surgery. But you have to go through this process. And I say it's a process because it rarely is ever a situation where people just practice it for 100 feet and they get it. It's like an ongoing thing where they have to practice it daily. And maybe over the course of a week, they'll get it. But then even as they practice running faster or hiking, if you're walking, like doing harder versions of walking and running, you have to still adapt to it and figure it out. So this is a process. It takes weeks. And once you figure that out, then walking and running is now productive for you so that you're not aggravating an ACL problem. In fact, you'll feel fantastic doing it. You're going to improve your health overall. All right, number 10 here. Patience. Huge deal, because when recovering from an ACL tear, especially if you're on the younger side, if you're in your teens, in your 20s, maybe even your 30s, and you had an ACL tear, you will probably heal slower than you're used to. It's a ligament. It's not a muscle. Muscles are red. If you just think of like meats when you cut them up, if you eat meat, it's red because it has blood in it. It has more factors that are blood-like. And one of those things is oxygen. And so it heals a lot faster. Whereas tendons and ligaments are white because they have less factors that are like blood. And so they don't heal as fast. So it just goes slower. So you have to be willing to say, okay, this is going to take weeks, months likely, rather than recovering from a muscle strain. Like that's going to be pretty quick, weeks at most. Ligaments just take longer, and you have to be patient. And then if it's an ACL tear, which is a big ligament in your knee, very important ligament that you use all the time whenever you're on your feet, you have to go through this process of getting stronger, making sure you're offloading and bracing. Like there's steps. That's why I built the whole program for this, making sure you avoid the things that make it worse. And that's tough because, I'm a guy on the internet telling you to do this. And I'm sure you might have seen a doctor in person who said, why are you listening to that guy on the internet, whether it's me or somebody else? Why are you listening to Dr. Google or Dr. YouTube when I'm a doctor here in person? But, and I get it. And I respect that because I've told patients that too. Like there's some funny things out there on the internet. But what is the ultimate test is try it out. Whether it's a live doctor you saw in person, advice from them, or somebody else on the internet. And if your body doesn't like it, don't do it. And I can't tell you the number of people that I've helped who I told them to stop using their quads, stop using their hamstrings, focus on these muscles instead. And then they're like, you know what? When I did do those quad exercises at PT, when I did what the doctor recommended and I got my hamstrings stronger, it hurt my knee more. Yeah, that's what I'm saying. And then when I did all this, it didn't hurt my knee. And it actually felt like I could walk and get to running faster. Yeah, I think I understand these biomechanics. I've helped thousands of people with this problem over the years, millions if you count all the people that we've helped on YouTube that we haven't had direct contact with. They comment on our videos all the time, like, I healed my ACL, never had surgery, followed your stuff, and this is it. It's simple. So have the patience. It takes months. Not days, not weeks, months. Got some bonuses for you guys. You know me. I got some good questions that I can see here. Somebody's asking, is this the same thing for an MCL? Let me just highlight you there. It's Holly Massey. Do the same things apply to an MCL? Yes, absolutely. And let me just quickly go to that side note real quick. Remember I said the ACL gets torn when you go this way? Well, guess what? Your MCL is right here on the side. And it also can get torn, partially torn, fully torn when your knee goes that way. In fact, if it's like a really bad injury, like the quarterback getting hit from the blind side injury that I was saying, it happens in soccer, happens in basketball too. People tumble into you. It's common to get an ACL tear and an MCL tear, and I would treat them the same. Brace it, offload, get these muscles stronger. You might need an insole, quit quads, quit hamstrings, figure out walking and running, wait a while. Keep doing that, rinse and repeat. Go through that until your MCL heals. Hope that helps, Holly. All right, let's do number 11 here. Massage. Because I find so many people overusing their quads and hamstrings, one of the things I tell them to do is to get a massage gun and start working on those muscles, free them up, because they get so overused because you work them out. And then when you walk and do normal stuff, they're being used most and your glutes aren't getting much activity. And so they just get tight and stiff. And then they put bad pressure through your knee joint. They start to affect the meniscus. They squash your meniscus. They squash the cartilage. It sets you up for arthritis. You need to calm those quad muscles down. And then here's the other thing that's super important with calming those muscles down. If you don't calm the quads down, the action potential, those of you nerds will follow me. I'll say it simply. The likelihood that the nerves that connect to the muscle, the nerves will want to fire. The action potential of the nerves that go to the quads is just higher. Like, in other words, you're going to want to use your quads a lot quicker if they're already stiff and tight. They're on the verge of contracting already. And so when you go to do something that requires legs, quads they take over right away. That's how compensations happen. But if you relax them with the massage gun, or you use a massage stick like this, because these cost a little more money. They're more affordable than ever these days. But this is $10-20. This is more like $50 and up. You can get them for even more. But this one is just a rolling pin style massager. And you just sit down and rub that on your leg and rub out the sore spots. That's all you're doing, getting that muscle to calm down. You'd be surprised what 2 or 3 minutes of this or this does for your knee. It can feel tremendously better, but then it sets your glutes up to work better, because now you can go to activate your glutes and your quads won't take over, because you'll be surprised at how many people I talk to, and this might be you if you think about it. You go to do a glute exercise and you try to activate your glutes and they kind of want to work, and then the quads take over. They like fire right away. That's that action potential thing that I'm talking about. The threshold for activity is just much lower. It kicks in right away. But if you relax those quads and then do a glute exercise, then you have a better shot at truly activating the glutes without the quads taking over so much. So it's more than just feeling good, massage, get the muscles to relax. It's preparing your muscles to work right. Very valuable. All right, let's do the next one here. Oof, this one's going to be controversial. I go head with my colleagues on this one. I'm going to spell this one out even. I want you to avoid balance training. I'm just going to write training like that. Sorry, it kind of looks like a J. Let me make that better there. Avoid balance training. Here's the thing. I'm not completely against it. Okay, let me start out with that. Like, it's not going to be wrong. I'll put it to you that way. It's not going to like completely mess up your ACL recovery and end up putting you in a situation where you have to get a surgery. The way that I come at it is it's not the best way to use your time, your energy, your effort. Because what I mean by balance training is like people will stand on one leg and say, okay, see how long you can balance, go 30 seconds, 60 seconds, make your muscles work. And this is training for your knee stability. This is how this is positioned. That's how they position it, the healthcare professionals. And there's research behind this, and they try to work at the gluteus medius, like they look at specific muscles. And yeah, it is strengthening a lot of those muscles. So that's good overall. The question I ask is, are you using your quads a lot, or are you using your glutes? A lot of times people aren't thinking about that. Healthcare professionals aren't telling people, make it a glute-focused balancing exercise. Make it a foot-focused balancing exercise. They're just saying balance. However you do it, just balance. They're just assuming that any kind of balance is good. I think we need to peel some of the layers back and first make sure that you can fire your glutes right, and you're not over-dominating with quads and hamstrings, that you have some foot activity and your abs are working, then go into the balance work. But if you frame it like that, there's a whole lot of work to do before you even start the balance stuff. So I would say that it's probably a better investment in your time, energy, resources to just go strengthen the heck out of these muscles. Don't even worry about the balance, because you know what? The stronger you get here, balance is just going to come. I mean, think about it. If you never ever stepped on a wobble board or one of those half stability ball things to work on your balance, and instead you just fatigued the heck out of the glutes, you got a heck of an ab workout, you got those foot muscles to burn, you're probably going to be better at balance anyway. If you went from picking up, a 10-pound weight on your glute exercise to a 30, a 50-pound weight on your glute exercise, if you went from doing 20 sit-ups to 100 sit-ups, if you got your feet used properly through a mile of walking and then you extended it to like 5 miles of walking, you're probably going to be able to stand on one leg for way longer, even without directly working on it. To me, this is just going the wrong way. This is taking a pathway that doesn't really shortcut anything. You need to just go through getting stronger. And I think that spending time on balancing, not worth it. Not worth it at all. You could do it, but I wouldn't skip this stuff. If I ever see you doing balance training, like if I'm your therapist or you ask me questions, the first thing I'm going to do is ask, are you working on your glutes, abs, and feet? If you tell me, yeah, I worked on my glutes, abs, and feet, then I'm going to high five you and say, go do your balance work. Just don't forget the glutes, abs, and feet. All right, last one. 13. Practice. This is a caveat. I'm going to put a big star on this one just so that I highlight it for you. Practice jumping. Here's what I mean. Let me explain this. Then we're going to answer a few quick questions and I got to go. People don't know how to jump. Not everybody. I just find a lot of people don't know how to jump. And it's going to be hard for me to demonstrate without the right camera angle. But I'll see if I can make it work as best as possible. Do I have a step? Yeah, I do. When people are jumping on the landing, this is going to work here as best as we can. If you see my knees here, I know you can't see my feet. That's okay. But when people land, so imagine I'm coming down from the jump, what I commonly see, and this is assuming you fixed everything. Even after people have fixed everything, even after people have had an ACL repair surgery, their knees do this. They land on the jump and then their knees come inwards. And that's how they recover from the jump. So they jump up and then land and come inwards like that. Not good. You need to practice jumping so that when you jump up and you land, your knees come outwards, because that is a glute-focused landing. When you land, your knees need to go out over your feet. Your knees need to be turned out. And you need to practice this so that it becomes habitual. So it becomes the way that you jump all the time. And here's where I get a little controversial and I get called out. Basketball players, pros, collegiate, across the board. You see them jump. You see them line up for the free throw, the jump shot, whatever it is. They're doing this, knees come in, and then they land like that. And that's how they take their shot. And how many basketball players do you see with ACL injuries? How many of them do you see get hurt with nobody touching them? Happens all the time. Every single professional basketball season, I'm just waiting for some poor, tragic situation to happen. I wish it wouldn't. I wish I could be there to help them, but the training right now is that it's allowed for the knees to come in, and that's just tensioning the ACL. It's using the wrong muscles. You're becoming quad dominant. You're not using the glutes. It's allowing the feet to collapse inwards. Toes aren't being used. Leads to other problems like Achilles tendon tears. That was the big injury that happened in the championship series with Tyrese Halliburton. Tore his Achilles, probably because he's got weak toe flexors. I did a video about it. Not a good idea to land inwards with your knees. So you need to practice jumping, and that's assuming that you fixed all the other stuff, because you shouldn't be practicing jumping if right now you need to be in a brace and on crutches. You need to do that first. Don't jump. This is advanced. All right, guys, I got a few minutes, like literally 2 or 3, and then I got to run out of here. So let's go through some questions here. I already answered one. All right, what we got here? Veronica Priest says, I've been told I need a knee replacement in both knees. Can this be avoided? 100%. Well, let me back off. I shouldn't say 100%. I don't know your situation. I'm just so used to telling people, because most of the time it is an avoidable situation. Let me take it from the other angle here, Veronica. If your knee can bend, and even if it hurts, okay, set pain aside. If you have decent motion in your knee, if it's 90%, if you have 90% of the motion in your good knee, or if both knees are effective, you have generally 90% of the motion that you had originally, that means that the joint itself works. It's just that it's painful and irritated, and you might have signs of osteoarthritis on your x-ray. You need to calm down the knee, and it's similar principles here. You probably need to be offloading. Bracing is not as necessary for osteoarthritis. I rarely recommend it unless you had an ACL injury too. Then you do need to brace, and you're still dealing with the symptoms. But offloading is absolutely necessary for osteoarthritis. And you probably need to do some of this stuff, maybe even insoles. Definitely need to stop quads. And if you can calm the pain down, then you're probably going to be in a situation where your motion's good because it was good already, but you calm the pain down, you can bear weight on it again, and you don't need surgery. We see people happen. We see that happen to people all the time, especially those going through our knee arthritis recovery program. So very, very possible, with the exception of you lost a lot of knee motion and it's been like that for months, like 3 months or more. Hope that helps there, Veronica. Robin's Egg says, hello, I'm Robin from Philadelphia. Hey, Robin. I just had my first knee replacement surgery on my right knee in late February. I'm so sorry to hear that. The one on my left is due next year. I'm having trouble bending it to be continued. Okay. I'll see if I can find it. Oh, yeah, we got some more comments in here. I'm being it around 75, but I'm bending it around 75, but my doctor and therapist want me to do more. But even before the surgery, I couldn't bend it past 100, I think. I don't know what to do. It still hurts, and I'm scared. There's another comment here. It was in a brace for 2 months after surgery, and I still have that tight feeling, even though I'm bending it throughout the day. Any advice is helpful. Thank you. See, this is a situation I'm talking about. Like, I'm understanding this is on your operated knee that you're having trouble bending it. There's a lot of reasons why this happens. This is one of the complications that can happen after a knee replacement surgery is, you have to, of course, do your therapy. And I'm assuming you did. You have to follow all the doctor's instructions afterwards, and make sure you have to move into pain. After surgery, that's the only time that I tell people it is beneficial for you to force yourself through some pain, but it's because you had a surgery. You were surgically cut. A surgery is a controlled injury. They're cutting you open with precision and doing a procedure in hopes that you're going to heal better than the situation you had currently. So this is a situation where you have to move. My recommendation to you, Robin, is tighten your belt, pull up your pants, and you're going to have to grit through some discomfort. Be wise about it. Don't flare yourself up too much. Probably going to get a little flared up. Work with your therapist, work with your doctor on getting it. You need to get it to move, though. Like, you have to. And if you're not making progress despite your best efforts, then it's possible that this could be where you end up, and you need to talk to your doctor about doing a manipulation under anesthesia, or see if you can manage with your current level of motion. Because if you can't, then the next step is probably going to be to do a revision surgery where they do a second knee replacement. And those are tough. Those are tough to do for sure, but it might be the best thing for you. So in summary, buckle down, push through your rehab so you don't have to have that second surgery, but be careful, and you need to work closely with your doctor and your physical therapist. All right, guys, that's all I got time for. I will chat with you guys next week. Thank you all so much for being here. Bye-bye.